Hello, hello, and welcome to our show, Discover the Best You. I'm your host, Doc Bowman. Today is our very first show. So we just want to tell everyone thank you for tuning in. This is with WDRB Media, the voice of the community. Just so you get to know a little bit about me, my name is Dr. LaTanya Bowman. I'm a chiropractic physician and owner of Discovery Chiropractic and Wellness Center. We're one of the top 20 chiropractic offices out of the city of Charlotte. Chiropractic is a holistic approach of treating the body without the use of medication. You can find me at discoverychirowellness.com. That's Discovery, CHIRO Wellness.com. And our office phone number is 704-946-2054. And today's sponsor is, of course, Dr. LaTanya Bowman off of Discovery Chiropractic and Wellness Center. So this show is going to have multiple of topics affiliated with health and wellness and just living a life of abundance so you can have and know how to be the best you. Of course, as you know, this radio show is called Discover the Best You. We're going to have special guests on our show as we discuss about how to be, of course, the best you. How 2020 is going to be the year of abundance. So we're going to have multiple of guests, and today we actually have a special guest, Dr. Martez Prince. How you doing?
I'm well. How are you?
Doing great. So just tell us a little bit about yourself and let us know what you do.
All right. Well, before I do that, I would like to say, first of all, congratulations on your show.
Thank you.
I think it's commendable what you're doing. It's important that individuals understand and know how to be the best them.
Absolutely.
So, so I'm Dr. Martez Prince. I am the CEO of Premier Pharmacy and Wellness Center. We are an independent pharmacy located right here in Charlotte, and we basically take a traditional approach. We modernize traditional pharmacy, and when I say that, I like to say that we allow you to experience pharmacy the way that your grandparents experienced it. However, we put in all the new, modern, and latest technologies to help improve that, to improve patient outcomes, to help patients become the best them that they can be. So we do have that in common. Our goal is to guide you to greater health, and we do that through patient education. We consider ourselves a lifestyle pharmacy. So we're not just about the lick, stick, and pour model and pushing pills out the door. We're about helping patients identify all of the different types of ways they can achieve wellness. And, sometimes patients may want to take a more natural approach to wellness, but and sometimes medication is required. So we're there to be their coach, their guidance, their concierge when it comes to healthcare and to guide them to greater health.
Nice. And a lot of people see a chiropractic physician holistically. We don't write prescriptions. But as for myself personally, I always see that it is a balance because you do sometimes need those medications, but it's about seeing the right physician, the right pharmacist, so you both can be able to make that patient be well. And a lot of people don't understand. When they think of health, they think of sickness. And so tell me about this past Friday, the event that you had. It was on TV. It was huge. So let us know what happened with that.
Yes. So we actually, we hosted a wellness fair and celebration. So this was actually our 6th wellness fair and celebration. And we do these events to bring individuals together, both those that may need help and those that are actually well. And we collide the energies together so that those that need the extra wellness and healing and good energy can rub off on those. But this past Friday, we had a chance to host a very, very special wellness fair. This wellness fair and celebration served as the kickoff to the Oprah's 2020 My Vision, Your Life in Focus tour.
Yes, she came in town on Saturday, but she was here Friday specifically for you.
Yeah, so she was here on Friday, and we had an awesome time. We had the opportunity to dance in the street in the name of wellness and to just celebrate wellness, celebrate being balanced, celebrate feeling good. And yeah, it was an amazing experience.
It definitely was. And I appreciate you allowing my office to be a part of that. And I absolutely loved how you had the different physicians there, especially all of them were African-American physicians. That was really huge. And was that an idea that you had collaborated with her, that you wanted small businesses that were affiliated with health and wellness there as well?
Well, when I received the phone call from her team back in October, when they explained that Oprah was specifically looking for minority businesses, she wanted to partner with them that was spreading health and wellness in the community. And so when we decided to put on the wellness fair, we service a majority, I would say, majority of our clientele is African American, being that we're located right outside one of the most historical Black neighborhoods here in Charlotte. However, we do service everyone and we welcome everyone. But for this particular event, we decided to reach out to some of our top rated physicians in the area, people that we had worked with in the past or had personal relationships with, and we invited them all out if they were willing to conduct free screenings on site for those patients. When it comes to the health and wellness fairs, one of the things that we like to do is this event is not designed to diagnose or actual treat the individuals on the spot, but to more so introduce them to different types of physicians or different types of screenings, wellness, ways that they can achieve wellness, and to maybe leave with a baseline of what that is so that they can discover or, do an additional follow-up visit at their own time.
Absolutely, absolutely. And again, when it comes to wellness, and that's the purpose of this show, is to show that wellness comes in different forms. It's so broad, and the topic is so broad. It's mental, physical, financial, economically. And so with today, I knew you would have been perfect as my first guest, because when people think of medical care, they think of medicine and drugs. And so what is your perception of with the overdose or the over medication that you're starting to see in the communities, where the medical field, I guess, how can I say it, where the communication is not there, where you see, like with my mother, for example, the communication of one doctor versus the other, and then they cross medication. And then luckily, I was blessed to have a pharmacist to catch those things. And so with that, I feel like small businesses affiliated with pharmacy, they're more in tune with the patient than the larger corporations. How do you feel about that?
Well, I think that's definitely true. It's not that. I think that whenever you go into healthcare, of course, your main goal is to make patients better. You have a level of care and love for patients, and that's why you're there. However, when you're in the large corporations, what tends to happen is larger corporations are driven by metrics and they're driven by quantity and volume. So usually they're trying to fit in a large volume of patients in the same time span that every other office is open as well. And that's usually due to the fact that when it comes to insurance companies aren't reimbursing like they used to in the past. And so therefore, these physicians or providers are forced to see more people. And when you force more people in that same time frame, you decrease the patient time with the provider, which decreases the level of understanding between the provider and the patient. And then also it decreases the downtime for the physician. So during the visit where the physician is typing up the prescription and sent over to the pharmacy, and they could have written on there, please discontinue previous prescription for blah, 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 blah. Instead, they leave that off. And, luckily or hopefully, a pharmacist would catch that these two medications are in the same class,
right.
let me call and double check to see if the physician actually wants to, to use these together or discontinue.
Right.
And the thing is, like when it comes to medication, a lot of medication, sometimes you can use, multiple medications from the same class and it could be completely fine.
Mm-hmm.
And so it is that, should I call to check to see if they want to discontinue this, or I wonder if they want to use this in conjunction with this.
Right.
But I always encourage physicians, like whenever I'm training my pharmacy students or new pharmacists or whatever it is, or even like at my practice, we have a pharmacy and a walk-in clinic. So even when I'm talking to our nurse practitioner, I always like to educate her on best practices,
right.
so that, just to see how we think over at the pharmacy and to try to understand how you guys think, like maybe in the clinic.
Right.
And so together we could, achieve the best operation for the patient.
Best care.
Mm-hmm.
And, that's one of the things that I'm like extremely grateful with the pharmacists that actually, my family lives in Winston-Salem, North Carolina. So when my mother would have to go to the hospital quite often, it had got to the point where the fire station that would come and get her from my parents' home, they actually had a nurse practitioner that would follow up behind her the next day, which was awesome. So she was the one that had switched us from a larger pharmacy to one of the ones that were smaller, but was able to gain more control and knowledge of what was going on with her medication, and it made a huge difference. Mm-hmm. To the point where I'm comfortable now, and I don't have anxiety about what exactly is going on every day with my mother taking her medication. And like they are even kind enough to even call me and check up to make sure, like, hey, your mother, I think she went to this particular place last week. She got a new medication, but we were looking at it and we see that this other medication was prescribed to her from the hospital. So we're going to cross-check to see which one they really want her to take. And so it has made me very comfortable. So you all are extremely important. That's one of the things I say when it comes to larger corporations, they are drowning out smaller health care businesses. And unfortunately, the insurance company is just not on our side. I think a lot of us don't talk about it, mm-hmm. but we all are having that problem because the insurance payouts are smaller. Mm-hmm. Which means that you have to see a larger influx of people, and that means that's in order to keep your overhead up, and that causes the quality of care to decrease. Mm-hmm. And so with that just plays a huge part on just making sure that each patient gets what they need. And it also causes a lack of communication between the physicians, just because of the fact that we're so busy all the time.
Yes.
And we're not able to fix and look at each and every person to make sure they're getting everything that they need. So, definitely. You're right on point about that. So what do you think about small businesses, healthcare small businesses? How do you feel about that at this point?
I personally love smaller healthcare facilities. Mm-hmm. The smaller healthcare facility, once again, they tend to hire those patients or they tend to hire that staff that truly loves that patient care, mm-hmm. and that tend to go above and beyond the call of duty.
Right.
Usually the people that you have worked for a larger corporation and have been working there forever and everybody knows their name.
Right.
Those are usually the people that end up working at those smaller corporations because they just love what they do.
Yes.
And I think that's that's important. So when it comes to the smaller, corporations, I think that, or I actually encourage all guests to find a small corporation in the healthcare industry to support. And I think that you would be extremely surprised at the level of care that you'll get. And, if you can't find a doctor's office or a full service doctor's office or anything like that, start with something like, a chiropractor office, or, maybe you're a dentist or something like that, and just pay attention to the level of service that you get.
Right.
And I think another thing too, there's a huge myth out there that by going to a smaller or independent, practice, you're going to pay more.
Right.
And that's definitely not the case.
It's the exact same cost. And we'll definitely get more in conversation about that a little deeper, because I would like to bring you on the show again to talk about that.
Okay.
Yes. Yeah. But a lot of people don't realize that chiropractic physicians are primary care physicians, just like a doctor of osteopathy and a medical doctor. So all three of us are able to treat and diagnose a patient. We're the only ones that are able to do that under Medicare and Medicaid. But, of course, the medical realm of medicine has the stronghold on everything. But it's just important that all of us are able to work together, because when it comes down to it, we're trying to get the patient well, but at the same time, even as a small business aspect, on personal level, we're all trying to survive. So in order to do that, we have to be able to, A, communicate, B, make sure that we're giving the best quality care to our patients, and 3, like what we're doing right now, is informing the public.
Yep, absolutely.
Yes. So thank you so much for everything. I appreciate what you've done, and thank you for coming on our show, and I'm proud of you.
Well, thank you. I really appreciate that. And saying back to you, I'm extremely proud of you for taking that step out and, doing your own thing. I think it's a big task, and I know, I've known you for a while now. We both wear multiple hats, in addition to trying to network and just be out there.
Absolutely.
And I think we both share the same common goal of trying to educate the public, which is extremely important. So kudos to you.
Yeah, and even with Oprah, what she's doing with Weight Watchers, that's really phenomenal. And I love how she's just so knowledgeable, and she's even pulling in those small businesses, allowing people to know, hey, don't forget they are here, because she could have very easily went and connected with larger corporations, but that's not what she did.
Yeah, absolutely.
Yeah, so that's the part I really greatly appreciate her doing that. So Oprah, thank you for that.
Yeah, absolutely.
All right. So thank you again. This is Dr. Bowman here on Discover the Best You. Again, you can find us at WDRB Media, the voice of the community. And you can find me on Facebook and Instagram at dr.lbowman. And our office website is discoverychirowellness.com. And tell them again who you are.
Yeah, I am Dr. Prince from Premier Pharmacy and Wellness Center, located at 3010 Monroe Road, Suite 101 in Charlotte, North Carolina. You can reach us by phone at 704-496-9182 or on the web at www.yourwellnesskey.com, and let us unlock your wellness. Follow me personally on Instagram at Dr. Martez Prince. You can visit my website, drmartezprince.com as well.
All right. Thank you. You're awesome.